My name is Alan. I'm an occupational therapist. I specialize in rural practice and in hand therapy. I see a good number of carpal tunnel patients that come into my clinic and treat them for carpal tunnel, as well as a lot of the painful things that can develop as a consequence of carpal tunnel. A lot of times carpal tunnel is kind of the first domino to fall, and then other problems can begin to occur in the hands, wrist, and forearm. That could be pretty painful. Over the last decade, we've seen several different newer devices come out onto the market for the treatment of carpal tunnel that gives us some alternatives besides just, sticking on some night splints or going in for carpal tunnel surgery. There are still some patients that do have to have surgery, but I think that with the things that are available, that number is far, far less than it used to be. Over the last couple of years, I've begun using the Carpal Rx more often. I find myself over the last couple of years using this for some of the more difficult patients that won't tolerate some of the other treatment methods that are available. It's nice that this really helps when maybe some of the other treatments might cause a skin reaction or some other complications like that. I found that this is something that patients can tolerate if they're willing to put in the time to do 15 minutes in the morning and evening and do that consistently day after day. I've seen some really pretty good results come out of this. Some of my patients that got most of their symptoms taken care of but just couldn't quite fully resolve it, using this for a month after that really helped to really chase out all those final symptoms of numbness and tingling and pain that they were experiencing. They really were able to achieve a full resolution. So I'm a big fan.